Good evening. Hi, everybody. Give everybody a chance to get their notification and come in. So I hope everyone's doing well today. The weather here hasn't been the best today, so I'm seeing on my screen here that I have a very unstable connection with the Wi-Fi, and I'm almost positive it's because of the weather. But I know there's worse weather, people dealing with tornadoes and just really bad wind and rain and weather in your parts of the country. So, hopefully and prayerfully you're not being impacted and everybody's staying safe. So let me go ahead and say hello to everybody. Hi, Brown Eyed Girl. Thanks for being here, Shadra. It's so nice to see you again. Thank you for coming in. I did have a blessed day today. Thank you very much. Very nice. Hey, Cat Green. I saw you earlier today. Hope you're doing well. And thank you for dropping off what you dropped off. I really do appreciate that. Daisy Girl, hi. Welcome back. Thank you so much for coming in. Oh, Winter Storm Lola came in with a bang. You said it yesterday. The winds and the snow were just going to be crazy. I can't believe that. That's nuts. Yeah, just nuts. Yes. Hey, Sweets and Beyond. How are you? Hope you had a good day. Welcome in and thanks for coming again. I appreciate it. Yep, hit the like button on your way in, folks. That lets me know you like what I'm doing, so I'll continue to do it. Party Rock, hello, hello. Thank you for coming in again. I appreciate you coming back. 40-mile-an-hour wind. And Shadra, how cold is it where you are? Because that 40-mile-an-hour wind with cold, ooh, that would be freezing. Well, I'm happy to hear that. I mean, I hate that you needed them, but I'm blessed to know that my positive vibes can provide you some happiness. So I'm here. I'm here for it. Sweets and Beyond busy today. Today was a very busy day for me. Um, Mostly spent at Moffitt Cancer Center, but did do some work as well. Let's see. I love it. All the highs and welcomes to everybody. That is so nice to see. What are we looking at here? It's right about time, right at 6:45 ish. So um, we'll kick it off, and if anybody listens on the replay, I thank you for watching on replay, and we'll go through everything. So 72 degrees, but in June it will be 120. Okay. Wow. Hello, Miss Liability. Thank you for being here. Appreciate you coming back in. Hope your Wednesday went well. Okay, so let's talk about my first Keytruda infusion. Sweets and Beyond, are you stalking me? Because my phone says it's exactly 69 degrees right now. I am turning the ring cameras on. Just looking for you. Just kidding. So my day today started very early. 5 o'clock alarm. Was out of bed by 5:15. Uh, let's see, I ate around. Yeah, Daisy girl, I like that. Yeah, hey Jendi, welcome back. Thanks for being here. Uh, up very early today. So had a little bit of breakfast and took my pills that I generally take every morning. They told me to, do everything like I normally would. So I did. Uh, and then I got to the Moffitt Cancer Center right around 7 o'clock this morning, which was great because my blood draw was at 7:05. I went and got checked in, and hey, Sarah Z, thank you for being here. It's nice to see you. Um, so went to the blood draw area, checked in. Since my appointment was at 7:05, I got called back pretty much right away. I think I had 2 minutes wait. Hey Maria, welcome. Thanks for coming back. It's nice to see you again. So after they brought me back to the blood area, I was done. It was quick. The lady was very quick. First stick, she got a good vein, which I don't usually have vein problems, and I um always drink a lot of water to get the veins pumped up in the morning. So yeah, they had no problems with that. So gave blood and then got sent up to the infusion center. The only downside to them being so quick with the blood work was my infusion appointment wasn't until 8:30. So considering I was done with the blood area at 7:12 or so, it was very quick. I had to wait a while up in the infusion center. So went up to the infusion center, checked in, and then just sat around and was able to do some stuff on my phone. I needed to get some things to work because I was expecting to be done at a certain time, but it looked like it wasn't gonna that wasn't gonna happen. So that was okay. But yeah. So um, while I was waiting for uh, the infusion center to call me back, I got a message through my Moffitt patient portal from my oncologist, Dr. Grogan. And Dr. Grogan said, "Hey, Pat, just wanted to tell you your blood numbers look awesome today." So that was awesome. That was so great to hear. And I love him for the way he is. That he will send me those types of messages. Same with MRI results. He doesn't want me having to sit around and worry and wonder what it said, what it shows. So yeah, all of my numbers were great. White blood count, white blood cells, red blood cells, hemoglobin, liver functions, all that stuff was looking great. Everything was within range. So yeah, it was very, very good news. So thank you all for that. That was great news. And then just waited. The lady told me when I checked in that even though I was here at the infusion center, she won't actually check me until 8:30 on her system. And it's because they were busy. The waiting room was so busy this morning for people getting all kinds of infusions. So, it is what it is. But it was nice to get that email. That definitely pumped me up. And then about 8:30, got called back to the infusion center where they did some vital signs, weight, different things like that. And then that took about 2 minutes, not much. Blood pressure was 112 over 73. I'll take that every day, all day. So very happy about that. I'm not on any blood pressure medication, so that's just me. Um, so that was a good thing. And then had to go back out to the waiting room for about another 10, 15 minutes. They called me back again, and my chair was ready in the infusion center. I was really hoping I would get some sort of room. Hey, Cree, welcome in. So nice to see you. Thanks for coming back. So yeah, I was hoping I'd have a room, but I didn't. So I just had a curtained off area. It was private still, but there was somebody next to me. So I couldn't go live. I apologize. I didn't want to be rude to the person who was in the curtained off area next to me. So, it is what it is. And so, yeah, so I get there, and um, the RN who was there to set up my line and my infusion, he comes in and he looks for a vein, finds a vein, and gets it again. First time. Like, you're awesome. So he gets me all stuck, and he puts get a saline line as well. And then he goes, all right, well, we're all set except the Keytruda is not here. And I was like, huh? They told me it was delivered yesterday. He goes, no, it was. But oh my gosh. I don't have a port. I don't know much about it either. I wasn't sure if they were going to give me one or not, but nope. I'm just going to get stuck with an IV every time I go, but it's every 6 weeks. So, yeah. Shadra, same for me. My right arm is the one they use. They can find the vein so fast. They're like, oh yeah, that's popped up. I'm like, yep, it's always the easiest one. So so yeah, so I was a little concerned, and then it took him about 25 minutes, and he finally came back with the bag of Keytruda. The Keytruda bag was maybe this big. There wasn't much to it, and I'm like, oh, hey, Jen. Thank you for coming in. It's always appreciated. It's nice to see you again in here. And I got your message last night. I was sleeping, or I would have been there. So I'm sorry I couldn't make it. So yeah, once it came back and he brought back this little bag, I was expecting a big bag of something of like a liquid, kind of like the IV bags you normally get, ones full of saline and stuff. Hey, Babs, it's so nice to see you again. Thank you for coming back. And it wasn't, it was a miniature bag. And I'm like, I said, that's a $30,000 bag of medicine. He goes, yeah, it's pretty crazy, huh? And so he hooked it up to the IV machine, and took 25 to 30 minutes at the most. The longest part was waiting for them to find, or waiting for the pharmacy at the cancer center to send up my bag of Keytruda. That was the longest part. So yeah, got a little delayed because of that, but it was okay. That wasn't going to get me down. So um, everything went well with the Keytruda infusion. Ooh, you had iron infusion's 2 hours long. Yeah, I was told that at the most this would take 2 hours. I'm sorry, 1 hour. But when he brought out the bag, I'm like, that's an hour's worth. He goes, no, this yours is only for 30 minutes. So I was like, man, okay. So yeah, they started it and it went quick. It was boring. I'll be honest. I mean, I didn't have much to do. I really wanted to go live, but like I said, unfortunately, because I had somebody curtained off next to me, that would have just been rude, and I didn't want to do that. So yeah, Shadger, I wish I was $1 million man. I mean, with between this thing and the Keytruda, that's 50,000 a month, 55,000 a month that's going into my body. So in a couple in about a year, I'll be right at about $1 million worth of stuff in me. So, oh, it's so crazy. But yeah, everything went well. During and after, no problems. got up and just left when it was done. When nurse was like, "You're good to go," I'm like, "All right." So overall, Jen, the infusion was 30 minutes from when he hit the start button. Uh, Overall, the process took a little longer because they, of course, had to um, jab me with IV needle, and then they had to find my Keytruda, which was actually at the pharmacy. So yeah, that was how the day went. It was a quick, easy process once it got started. Um, and I was out of there about 10:30. So yeah, it's pretty crazy. Yeah, Shaja, I agree. And the only reason I'm able to get this treatment, the Keytruda, and not pay $30,000 a month, because one, that would I'd be filing bankruptcy. Um, but it's because I got accepted into the patient access program for Merck. So for this year, I'm not paying anything for these, so I'm very happy. Hey, William Brooklyn, so good to see you again. Hold that chat crew down. I appreciate you for being here again. Yes, thank you, Maria. Yes, it was. It's nice to have that, and it's like I said, they're covering every 6 weeks for 1 year. So for a year, I don't have to worry about what the cost would be. Oh, nice. Now, Jen, if you don't mind me asking, was that an iron infusion or did you get blood infusion? What kind of infusion did you get? You don't have to share if you don't want. Yes, Maria. Don't you just love autocorrect? It's pretty crazy. So yeah, I got accepted, and so I'm so happy. Okay, all right. Thank you. Thanks for sharing that, Jen. But yeah, so I think next time I'm gonna bring either a book to read or something else. But I was lucky, especially if I get a larger dose where it is going to be longer than 30 minutes, then I would definitely I would definitely um, need something to do because it was boring just sitting there. So yeah, it was a good day, and overall the weather it was iffy today. Not even gonna lie. Started out a little cool this morning, but it was nice outside, like no rain. But then around 11 o'clock, the skies opened up here, and it just rained and rained and rained for a while. So that wasn't fun, needless to say. But it is what it is. I actually had to change my electrodes today because with all the rain, I waited as long as I could, but they got wet, and so even wearing the cap, they got wet because it went right through. It was raining so hard that it went right through and got them wet. So when it started burning my head, I'm like, yeah, need to take these off. So I took them off and got new electrodes on, and I feel great. So yeah. Again, it was a great day. I'm happy the blood work looked great. Um, but besides that, everything else went well today. I had a meeting with my HR manager. I had to go over a few things with them, and that was great. Yeah, exactly, Daisy girl. I do not want to burn my head, and I just assumed it was a reaction to them getting wet because it's never done that before. It gets warm sometimes, but I'm talking about just warm, not like hot could burn your head if you leave it on too long. So good question, Jen. I'm gonna wear it until I don't need it anymore. and hopefully I don't need it because I've been cured. So yep, this stays on, and it's been shown to be a good treatment. So it's good. It works for multiple types of cancers too. I don't remember them all. I believe. Well, I know lung cancer is one that they've started seeing some good results in. I want to say like multiple myeloma, or some other thing. I don't remember what other one she said, but yeah. And it's look, there days I want to throw. This is the actual machine. It's not big. It's a very small device, but it beeps. And when it beeps, because my electrodes are getting too hot or something else. There could be any reason. Oh, the battery's dead, something like that. I want to throw this thing as far as it goes because the beeps get so annoying, and you can only shut them off for 5 seconds. And then if you haven't changed them, change what needs to be changed, then next, 5 seconds later, beep 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 beep. I'm like, enough. Hey, caller friend, welcome back. Nice to see you again. Oh, I like that, William Brooklyn. Grandmother and I would play cards during your treatment. It was. I've always been a a builder like Legos. I've always been a Lego fan, and I've also been one to do puzzles. And I found it so funny. They had like 20 puzzles lined up. So next time I go, I'm gonna grab one and bring it in the back and do a puzzle. I think I can finish a couple hundred pieces in the 30 minutes, if not 1,000. No, I don't think I can do 1,000 in 30 minutes, but I can do a couple hundred. So yeah. But yeah, I mean, all sorts of options. And there was a TV there. I never turned it on. It was, I don't know. It would have been nice to have a room where I could just, not worry about the volume and stuff like that. But I didn't want to be a nuisance or a bother to anybody. So I didn't turn it on. That was okay. So next steps are, let's see. Cat Green does puzzles on a phone app every day. I like that. I do crossword. There's a crossword one called Daily Themed Crosswords. I do that. I enjoy that. And yes, some people do crochet. Um, so Maria, if you're ever up in the Tampa area and I'm having a um, what is it, a infusion, feel free to come crochet. Just don't just don't hit me with any needles. But yeah, thank you, Jen. I appreciate that. That's very nice. But I would feel like I am to them, and I just didn't want to be. All right, Party Rock, I like that. You research plants at the doctor's. We just had a huge plant sale at one of our parks here in Tampa last week, and they had all kinds. Nice, very nice. I love it. Just a hook. Oh, I love it. Yep. So yeah, it's been wonderful. And Kat Green brought me a prototype today of something she was working on for me that I asked her, and it came out so beautiful and wonderful. So I'm so appreciative for her, which I'm sure that doesn't surprise anybody because she's awesome. Hey, I will gladly learn to crochet. Oh, Shadra, you messaged me today to send me best wishes. I appreciated that. That's part of life, and that was so nice. Oh, nice, Jen. Very cool. I like that. Huh. Got me emotional. I would read with Grandma. She loves sports pages. Hey, that's always good. I like that, William Brooklyn. And sorry to hear about Grandma. how this makes you emotional. But no doubt, lots of love there. Hey, that Laura Marie, welcome. So nice to see you again. Thanks for coming back. And Laura Marie, I was just sharing with everybody that the infusion went well. It ended up taking about an hour. However, only about 25 to 30 minutes of it was from start to finish for the infusion. The hardest part was waiting for them to find my bag of Keytruda because it wasn't up in the infusion lab when I when my time was to be in the chair. So they had to wait for the pharmacy at the hospital to find it and bring it up there. So, so yeah. But thanks for being here, Laura Marie. It's always nice to see you. I had a different type of cancer, but immunotherapy worked for me. 18 months of remission and counting. You can do this. Just wanted to give you some encouragement, Stephen. That's so nice of you, and I love hearing stuff like that. I they got me on a lot right now. So this Optune device, these are called tumor TTF, tumor treating fields. I'm on that 5 days a month. I am on a chemotherapy pill called temozolomide or Temodar for short. And then also now on the immunotherapy. So, yep, I'm excited to see I've done well with all the other treatments. So now adding the immunotherapy, I'm um, I'm excited to see. Hopefully it does more for me. I don't have any tumor that I'm aware of at this time. All of the MRIs through February have come back clean with no evidence of disease. And I have another MRI coming up on Sunday, which will be my 8th month. Actually, is it 8 months? 8 months post surgery MRI. So hoping that shows clean as well. But yeah, that was very nice of you, Stephen. Thank you so much, and congratulations on the success you've had. And I pray for continued success with everything you're going through. I'm not political by any means. I hate politics. I hate the bickering, the back and forth. I hate it all. But last night, in one of my cancer support groups that I'm on, they posted a video of a kid who was invited. I don't know if it was by the president or whoever invited him, and his dad. And he was given months to live. He has brain cancer. They didn't say exactly which one, but they just the president said in the clip that I saw, the president said he was diagnosed with brain cancer. He was young, like 3, 4, 5. I don't remember what age. It was at a young age. And they gave him at most 4 months to live. And 6 years later, here he is. And he was a guest of somebody at the presidential address last night. And he had always wanted to be. His dad was a law enforcement officer in Texas, and he had always wanted to follow in his dad's footsteps and become a law enforcement officer. And they said that he had been, what's the word that's used when he's not a official officer, but he's kind of given him. They've kind of given him like a title of a police officer, even though he's not. Just kind of, really nice things for them to do. Yes, DJ was his name, and he was waving to everybody, and then the president then started talking about how, well, honorary. Thank you, Babs. Well, he's been made an honorary law enforcement officer by by numerous law enforcement agencies, and they all love him. He loves law enforcement. So we're going to do you one better here tonight, and we're going to make you a Secret Service agent for the United States of America. And the kid just got this look on his face like, what? Are you serious? And I guess it was the CIA director or whoever's over that Secret Service um, gave him his credentials, and it was such a cool thing to see. If you oh, what was it? If you YouTube DJ, was his last name Dennis? Does anybody remember? I think it was DJ Dennis. But if you just do DJ um, Secret Service, you'll find it. You'll find the clip. It's only about 15 minutes. Very quick to watch. But that inspired me so much seeing the DJ Daniels. That's what it was. Um, so it inspired me so much watching this kid who was dealt such a horrible hand from a very young age, and he is just thriving. Kid had a smile on his face the whole time. He was so happy to wave to the crowd. He even gave the little love sign to everybody, and yeah, it was unbelievable. So just kid inspired, that really inspired me so much to see. And yeah, Babs, I can understand how that would make you cry, because it was so emotional, especially seeing his face when he understood what was happening. He couldn't have been happier. And then he gave the CIA, or the Secret Service guy who gave him the badge, he gave him the biggest hug. uh it was such a wonderful thing. If that doesn't make you happy and you can't be happy for that, then I don't know what's going on with you. But it made me so happy to see, because very inspiring. And his dad's right there by his side the entire time, holding him up. He picked him up and held him up a couple times. It was such a great thing to see, and just wow. Yep. Man, thank you, William Brooklyn. I I don't need to hear that, but it's such a good thing to hear. I'm if my goal in life, and this is something I've lived by um, for a very long time, is my goal every day is to touch somebody in a positive way, somebody I don't know. So whether it be at a grocery store, at a mall, something, just to make sure that I leave a positive impact on whoever I'm around. So that means so much, William, to hear or to see that. That is that is something sweet. Shadra, 16 years of it now, and I know you hurt from it sometimes too. So just hope continue getting better, and it can give some you can get some relief. That'd be awesome. So yeah, for anybody who is watching this and has never gone through an immunotherapy or an infusion, couple of things to expect. Bring water, and bring a blanket. It can get cold back there, and I understand they keep it cold to begin with because they want to keep the germs down. But it really was an easy process. I was going into it today. I was cautiously optimistic, a little nervous, and then I saw the process. And once they get you hooked up to the IV, and they get your bag of treatment hooked up to the IV machine, then they push the button and you're done. But they explain everything to you prior. They're not going to do anything without you knowing. And they verified everything. Um, it had me even verify the bag to make sure it was my name, my date of birth. It was the right medicine I was supposed to be getting, which it was. I was looking for Keytruda, and I didn't see it. It was pembrolizumab. That's the actual name of the drug, but for commercial purposes, they call it Keytruda because it's easier to say. But as I was looking at the bag, I'm like, oh, there it is. It was little parentheses. So yeah. And yep, if I have any side effects, speak to my oncology nurse. They can help you with the side effects. I that is absolutely something they stressed, and I like that a lot. Even the pharmacist came up and talked to me about it, and she gave me a packet of things to read over, and I did. And yeah, there's definitely a lot of potential side effects because we're firing up the immune system, and the immune system can fight other organs that are perfectly fine. So if I start feeling pain or like extreme tiredness, things like that. So yep, thank you, Stephen. I'm gonna read through. I've got 2 packets of stuff today to read through that were given to me. So me too, Shadra. Yep. I depend on God for strength, alien, to keep positive. It goes back to that live show I did about my testimony. Like that's how I can remain so positive with such a terrible diagnosis. I know where I'm going. If it's my time, it's my time. That was decided well before today. So you know we're going to keep praying that everything goes well. But when it's my time, it's my time. Nothing I can do to change that date. That's already been determined. All right, Chadra. Thank you. You were actually in early tonight. So, thank you for being here. And there's never a reason to apologize. Like I said, if anybody comes in for 1 minute, 5 minutes, or what are we at? 37 minutes. I'm grateful. I'm so grateful for that. We had another 20 something viewers today. Um, it's great. It makes me so happy to see. And again, continuing why I do this. It motivates me to be here talking with you all. And yeah, so that's why I do this. You all are a very big inspiration to me every night. I wake up during the week looking forward to doing this. Some nights I don't know what I'm going to talk about, and I'm like, what should I talk about today? Like days like today were easy because I've been talking about getting my Keytruda. Well, it finally happened, and so that's what we talk about. So my next appointments, the only 2 appointments on the books at this time are an MRI for around 11 o'clock on Sunday afternoon. So actually, it's like 12 something, 12:50 or something like that. I think now. And then next Wednesday, the 15th, I will have another blood draw, and I will have a clinic appointment with my oncologist. So at that time, he will go over the MRI, he'll go over my blood work. My blood work has been very stable since I've started with cancer treatments, chemo, radiation, all that. So I'm not expecting anything different on the blood work, but still got to monitor it, especially with the immunotherapy, because it can attack cells. So I've got to keep a look at the white and red blood cells to make sure we got plenty of them. Stephen, thanks, Daisy Girl. I appreciate that. And yes, Sweets and Beyond, hit the like button. Whether you're coming in or going out, hit the like button. So, Stephen, I got sick 3 days after my first treatment, the only time. The nausea medicine worked amazingly. So I have that same one. When I was on the chemo pills, the first round of chemo that I had was only about 160 milligrams of of uh, chemo pills to take, and I never had any issues. However, when they put me into the maintenance dosage, which was 385 milligrams, the first night, oh, I woke up so nauseous and definitely had some vomit that night. And ever since then, I'd taken on Densitron. I, if I said that correct, then lucky me. Um, so I take one of those 30 minutes to an hour prior to taking my chemo pills. And I've had no problem since. So, yep, they are so good at working. And even my doctor said if you didn't take it and you wake up feeling nauseous, take one right away because it immediately, they dissolve under your tongue. They immediately hit your bloodstream and it gets rid of the nausea. So I've been lucky it only happened once, but haven't had that since. Jindy, I have heard of Teddy Mellencamp, and if I'm not mistaken, she had multiple glioblastoma tumors, which is just terrible to hear. You know, I'm lucky I only had one. Nobody ever wants one, but let alone multiple is just, oh, it's terrible. Daisy Girl takes Zofran. Yeah, yeah, Zofran is another one. Yep, they're a godsend. I agree. But yeah, um, I like the Ondensitron, and very fortunate my doctor gave it to me because it's wonderful. Yeah, Jindy, and being and going through what I'm going through, I know what her doctors have told her. I know, you know, it's never good news to have a glioblastoma. Um, so, I hope that she can still live a long, healthy life. There's so many treatments out there now. Even since I started getting treatments, there's additional ones out there. I've mentioned it before, but the Sono bird is something that if I ever do get a recurrence or a tumor recurrence, I'm gonna find. Well, I know my hospital, my oncologist told me, my cancer hospital is a trial hospital for the Sono bird trial, and he told me, if there's ever a recurrence, he goes, "You're not ready for it now. You don't have any recurrence, and you're looking good, so you don't need this." But if there ever was one, he would get me into that trial. And so yeah, just in the 8 months I've had my diagnosis, it's they come out with something new every day. It seems like, and they're still testing. So even while there's trials going on, there's more testing going on, and they're trying to find the right combination of treatments, the right combination of drugs, whatever, to help. So I try to convince people to never lose hope. Uh, it's great. Yes, teaching hospitals are great. We have a big one here called the University of South Florida. That's our college here in the Tampa area, which is funny because we're nowhere near South Florida. We're in the middle. Um, we are on the eastern side of the center of the state. So why it got called the University of South Florida, I don't know. But over in Orlando is the University of Central Florida. So, guess we couldn't be the same thing. And but yes, our USF hospital is a teaching hospital, and then we also have a massive hospital here called Tampa General Hospital, and they are a big teaching hospital. So, yeah, we're fortunate in the Tampa area. We have so many good hospitals, and even not. I'm not going to say not far, but northwest of me in actually northeast of me. I'm sorry, in not Jacksonville, but I can't remember where is that? St. Augustine. In St. Augustine is the Mayo Clinic. The Mayo Clinic runs all kinds of brain cancer trials. So if I ever had to go there, that's not out of the question. So, I hope I don't. But, like I said, we're just blessed with how many great facilities we have in Florida, especially in the Tampa Bay area. So, well, I want to thank you all for sharing your time with me tonight. Again, always a blessing to see the names that we have here and new names when you come in, or surprise names when you come in. I love that too. So yeah, thank you all for your love and support. I am so grateful and appreciative of that. Um, I will definitely be live tomorrow. Um, Not sure what the topic's going to be yet, but I will be live tomorrow. If anybody wants to come up on panel tomorrow, I'll drop the link. We can have a conversation. We can do whatever. As long as everything is on the up and up, that's all I care about. So thank you all for joining me tonight. I hope everybody has a wonderful night. You too, Sweets and Beyond. Thank you so much. So everybody have a wonderful night, and I'll be live tomorrow for you all. So God bless and have a great Thursday, everybody.